I just don't understand what Washington doesn't understand about what our working families and small businesses are going through. In my state, over the last 10 years, median family income has actually gone down by $800 in real dollars. And the cost of health insurance premiums have gone up 97% during the same period of time. There are people that want to leave the system just the way it is, but the result of having flat income for our working families and small businesses, and for those costs going up 97%, by the way, in my state, the cost of higher ed's gone up 50% at the same time. Cost of health insurance up by 97%, cost of higher ed up by 50%. This is really tough on the middle class. It's really tough on small business owners in my state. And the result is, if we leave the status quo, this is a great irony of the arguments to keep the status quo, is by default, Mr. President, we are putting more and more people off private insurance and more people either on public insurance or having the benefit of uncompensated care. So we've seen in my state, and you can see it on this chart, probably not all that well, but small business spends 18% more for insurance than large business just because they're small. And fewer people in Colorado are able to get coverage at work. Before this recession started, it had already dropped roughly 10 percentage points. The percentage of folks that were getting insurance from their employer, from our employer-based system. And you can see, the Senator from Ohio certainly can see that the percentage of small businesses in my state able to offer health insurance has declined dramatically. Well, where do these people go? They either end up on Medicaid or they end up showing up in the emergency room where they're treated with uncompensated care, the most expensive way we can deliver health care in the United States of America. We have a wonderful public hospital in Denver called Denver Health, where they do an amazing job at a much lower cost than a lot of other hospitals. And I was told by the woman that runs the hospital, her name's Patty Gabeau, gifted administrator, that they had done a study and they discovered that they had spent $180 million in 1 year on uncompensated care for people that were employed by small businesses. These weren't unemployed people. These weren't people that could have had access to Medicaid. These are people employed by small businesses who can't afford health insurance. So one of the ironic things about the debate we're having is, I think, the failure to recognize that the status quo is creating a situation where fewer and fewer people have private insurance and more people are moving onto the public insurance, but it's not being done in a thoughtful way. It hasn't been constructed that way. And so I think that's one of the reasons why it's very important that we're having this debate. I tell the senator from Ohio, I'm sure he had this reaction when he was on recess. I certainly did. I had town halls all over the state. And what I kept hearing from people was, and this is the reason why I support a public option, was they'd say to me, Michael, you know, we paid every single year after year after year into private insurance. Every year we did what we were supposed to do. And then when we needed it, it wasn't there for whatever reason. Because somebody on the other end of the telephone told them, you're not covered, or the fine print didn't cover you for that problem, or your child for that problem. And they deeply resent the fact, as I would, that somebody earned a profit off that commercial transaction. That's the thing about insurance. You know, it's not like going to the store and buying a loaf of bread or a gallon of milk when you know what you're getting in return. Many people that buy private insurance year after year after year don't know what they have until they need it. And they don't know what they've lost until they lose it. And having a choice, just another option that's out there, not a government takeover of healthcare, but a choice that empowers working families in my state to make the decisions that are in the best interest for their family, for their children. As a father of 3 little girls under the age of 10, I can understand why people would want that choice. And I'm not scared by that choice. We have to design it properly, and the HELP Committee did a very good job designing this and answering a number of the charges that have made against it. We may be able to do a better job in the final legislation. But here's the final thing that I'm hearing from people in Colorado, is that if you're going to mandate that we have insurance, if you're going to require that we have insurance, you better make it affordable. You better not tell me that I have to have insurance and make it unaffordable. You better not tell me that I have to have insurance and that I've got to change the plans that I have for my family. The public option just provides one more choice for people, an affordable choice for people. We got to do a lot more to drive down costs, as I've talked about on this floor and others have, but we need to do this right. And I understand, I come from a state where we have got a lot of diversity of opinion on a lot of things. And there is a lot of concern about the way the system works today, and there's a lot of concern that we're going to make it even worse. And I think we need to elevate the standard of the discussion that we're having to the standard that we had, that the people of Colorado had in town hall after town hall after town hall, which, by the way, no one would ever have any interest in putting on TV or watching on TV, I'm proud to say. We need to elevate the standard in Washington of the discussion so that we can produce a result that has something other than double-digit cost increases year after year after year for working families.
Question. I heard what you said about buying a loaf of bread and how insurance is different. Before you were in the Senate, you were the superintendent in Denver Public Schools and very successful in business before that. Talk for a moment when you talk about how insurance companies deny care and insurance executives get paid well. Talk for a moment about the business plan. I mean, when you were an entrepreneur and you were a business person, you obviously had a business plan. Talk to us, share with Senator Udall and me and others, what the business plan of a health insurance company in particular is.
Well, I appreciate the question, and I'll say that I used to make my living buying bankrupt companies. So these were companies that were actually fairly well managed but capitalized really poorly, and our opportunity was to buy them, capitalize them properly, produce a business plan like you're describing, and make sure that the people that worked for them, people that benefited from them, continued to be able to do that. You know, as a capitalist, I look at the state of our health insurance industry and our health delivery system, and I can almost not believe what I see. I mean, if you go, we have 64 counties in Colorado. Every one of those counties has a convenience store, at least one. Some, many more than one, at least one. And with the exception of the loose beef jerky that's on the counter, there isn't anything in there that doesn't have a barcode on it. That's 1970s technology that our small business owners in Colorado know is critical to managing their inventory, critical to allow them to be competitive and give their customer what they need. 3% of hospitals in this country have that technology. One out of 25 doctors have that technology. You know, which is a really simple thing, and it's the reason why, as a parent of 3 little girls, or if you're caring for a parent of your own, it's so frustrating when you go in and you have to explain over and over and over again what the last person just told you, simply because we don't have a system of electronic medical records. And then on top of that is a business model where, unlike everything else in our society, is a business model where every year the costs go up and the quality to the customer goes down, which is what we see with insurance. We don't see that in other parts of our private marketplace where we don't see that in other parts of our private marketplace where people are incentivized to compete on price, on quality, on customer service. And it's why it's not just enough to have a public option. We need a public option. We also need common sense regulation of insurance so that we start driving a marketplace that actually makes sense.
Senator Bennet, one of the things that's happening, and your chart there really exemplifies it, and I wanted to get you to talk about this a little bit. Your chart says rising healthcare costs are hitting small businesses the hardest and forcing all Colorado businesses to make tough choices. Now, that's exactly what's happening in New Mexico. It's exactly what's happening in Ohio. And really what we have going on here is very hard-working, good small business people that want to give their employees, insurance. And I hear that. I know the senator from Ohio said that a number of times in red letters. They want to give that insurance, but they can't. They search around and they can't find policies that they can afford, and so they're really stuck. And I could give you a lot of examples in New Mexico. And one of the things you pointed out on your chart that even before the recession, fewer Colorado small businesses could offer coverage. I was wondering if you could talk a little bit about the small business situation, because most of these people are working without insurance.
And I appreciate the senator from New Mexico raising that. You know, I remember a florist that I talked to. He's had a family-owned business since 1972 in my state, and he's now down to no employees. It's just his wife and himself that are running the shop. They had health insurance for many, many years, and they took it, like so many small businesses do, as an article of faith that part of their job was to offer insurance to their employees, to make sure that their employees had the benefit of insurance. Now, they're the only 2 employees. There's no one working for them. They don't have health insurance themselves, and their daughter has been admitted to the University of Colorado, and he said to me the last time he saw me, he said, Michael, you know, what was she supposed to do when she got to the box that said, check the box if you have health insurance. If you don't, you have to pay this terrible fee. So first of all, people are having to make choices that they shouldn't have to make and they wouldn't have to make in a rational private market that was working well. That is one of the issues. The second thing is, as you know, and I'm sure it's true in New Mexico and Ohio, it's certainly true in Colorado, most of our jobs are created by small businesses. Depending on the numbers you look at, roughly 70% of our jobs are created by small businesses. A higher percentage of those jobs are going to be responsible for the recovery that hopefully we're about to have in this country. And it's just harder and harder to do that if you're carrying the freight of double-digit cost increases every single year. The last point I want to make on this, and every small business owner understands this, as small business owners have had to try to hang on to insurance for their employees, and the price of that goes up and up and up. What that leads to is a choice between holding on to the insurance and compressing the wages of the employees, because you can't do both. You can't give people the increases that they deserve in their compensation and at the same time hold on to health insurance. So there is a reason that we've seen all across this country actually a decline in median family income. It's gone down by $300 over the last decade in the country, $800 in my state, while the cost of insurance has gone up by 97%. That wage compression is directly linked to the problems that people have holding on to insurance.